personality disorder. So, Bismillah. What happened is sometimes all of us gonna be exposed or already exposed to some trauma. What do we mean by trauma? Any stressful event. So patient who goes through the war, they have a trauma. So in America, if you work in the VA hospital, you will see a lot of people who are veterans. Shane veterans, yani, has been to the military. So if you are on call in the 4th of July, when they hear the sound of firework, they remember the time where they were in Vietnam, and they go and hide under the trucks. Most of them will go hide under trucks or feel nightmares. So any extreme traumatic stress like war or rape, if somebody is raped, la samahullah, they will develop intense fear and helplessness, and terror means very, very bad fear. And they are trying to avoid re-experiencing the trauma. So when they hear the firework, what will happen to them is they remember the time where the fire was going on them in Vietnam, and they feel extremely anxious and irritable. Remember the first case we mentioned when the lady named Samantha, when her mother tried to put the coat on her, when the doctor tried to put the coat on her, she remembered the flashback of what happened to her in her childhood. They have increased arousal, so this symptom usually is very disturbing. The patient will feel numb, will feel depressed, will feel sad, and they last usually for a lifelong. If it's less than 1 month, we call it acute stress. So if you have the same exam question, the same symptoms, if the period less than 1 month, we call that acute stress. If it's more than 1 month, if it is like 30 days and 2 seconds, it will be PTSD. If it's 29 days and 23 minutes, it will be acute stress. Okay. So what happens when we have a trauma? Let's see, there's a lion coming here. So Dr. Ali, what will happen when he either gonna jump and fight with that lion, or I will go from up, most likely I'll go from up and scared and leave the theater and let him eat you, because you are more delicious than me, right? You are very delicious. So this is what we call fight or flight. So whenever we have a trauma, or sometimes we just disassociate. That means I will sit here and I just don't care. Why? Because in evolution, when the lion is trying to eat you, if you stay in your place and not run, he will think you are dead, and lion does not like to eat dead people, so he will not eat you. So by evolution, we learn when we have a trauma, either we tensely fight or flight, which we use different hormones like norepinephrine, dopamine, GABA, or we can use what we call dissociated hormone like opiate and dopamine. You don't need to know all of this, but the main thing to know is sometimes when we have a trauma, some people react differently, either become anxious and tense all the time, or sometimes they give up. For example, if you had, la samhallah, a bad marriage. In the beginning, you will fight with him and try to get divorce or kill him, or he kill you, all that, la samhallah. Then, at some point, you just give up and you just live your life, or living. You cook and take care of him, but you are not enjoying. You just associate yourself from that trauma. And there is a lot of women like this. They just disassociate after a failed marriage or failed relation. You just give up and use different hormones. So this is the symptom of acute post-traumatic stress disorder. First, repetitive thought, intrusive thought. You are sitting here reading about the exam, thinking about what's going to happen to you in 2 years. Then these thoughts will intrude into your brain and try to make you, these bad memories try to make you shaky and nervous all the time. Or you try to avoid them, so if your wife comes and scream at you, for example, this lady screaming at her husband or her brother, when she screams at him, it will bring bad memory from childhood where he just doesn't want to know about it or hear about it. You cannot sleep, so you stay all night not able to sleep, and you know, you have a change in thought and feeling, and sometimes you lose interest in things that make you happy, like going to the park or going to eat or being with a friend. Most of these patients, when they have a trauma, they like to stay at their home. They don't like to go to the mall or go to the library or do anything. So what happened to us, there is two parts of us, I need you to know this very well, called Eros and Thanatos. Eros and Thanatos is really different. Eros is the desire to live. So if you see somebody is excited, doing research, getting out, trying to talk to girls and boys, and trying to socialize and trying to make a lot of friends. So he is under the Eros, where is the, what we call it, enable people to survive and heal. After the trauma, you become very happy and you thank God for the test and for the trauma, and you want to keep on going. Some people will go back to the desire of dying. So they say the purpose of life is death. So you just keep wanting to die and have no interest in life, and you become isolated and you just exist. You are not creating anything, you just eat and drink and go back to sleep without any purpose in life. So we call that Thanatos. So always the Chinese discover that, called Eros and Thanatos. Eros is the desire to live and wanting to do something and find something, and Thanatos is the desire just to give up and live. Most patients after trauma, they just go to Thanatos, means they just, I had one lady, I told you about her, she was one of my patients, and she speaks with very, very soft tone voice, and she was traumatized to the point where it was so bad, because her father used to rape her when she was a child. And what happened is, after she became like 20, 30 years old, she would come to the clinic and she almost sit like this, which we call, it's a fetal position. And she just doesn't want to do anything. She just speaks with tiny little voice. She is scared. She doesn't volunteer any information. She just look at the floor, and we just give her the medication and try to do therapy with her. But she cannot do anything. She is so traumatized to the point where she just don't do anything, because she lost her interest in life. So her life was really shattered by what happened to her in the childhood. So you see a lot of them, when they are under severe distress and severe trauma, they look at this fetal position, because this is the safest position your unconscious mind remember when you were in your mother's womb. And this is what happened to that depressed lady. So they live in what we call survival mode. Survival mode means like you cannot focus, your memory is just not there, you are tired all the time, fatigue, you just don't care about your basic needs, so you don't put any makeup, you don't clean yourself well, you don't do anything but the routine thing, you eat the same breakfast, which is falafel and makdoos all the time without any change. And you feel more impulsive and you're zoning out. That's mean you try just, you are there but not there. So you sit with people and you just don't volunteer any information. So basically you feel existing rather than living. So you just eat and sleep. You don't visit a friend, you don't call anyone, you don't interact with anyone. So we call that survival mode, where you isolated yourself from your family because you had failed things in life. So this is the worst position to be in that survival mode. So this is what people after trauma have, and most of them will have PTSD, we call post-traumatic disorder. Some people might go to use drugs and alcohol. So you see a lot of people after a trauma, especially those being to war, they go and abuse drugs like alcohol and marijuana just to medicate themselves. Some of them will develop panic attack. Some of them will have no reaction, so they need trauma, but they live their normal life, and we're gonna see why. Some people will have acute stress, so they have acute stress as PTSD are the same, but the difference is the timing. So this is less than 1 month, This is more than 1 month. Some people will become depressed, some people will develop fear, and some of them will become obsessed and develop OCD symptoms. So we'll talk about that. And this is what happened, we see it, I explained this to you, is all the trauma is located in the hippocampus. The hippocampus is our memory storage, and it has a lot of gigabyte here. And then these are dormant. Dormant means they are there, but most of us will forget about them. Then something happened and the amygdala will trigger the fight or flight and bring these memories back to life and make you feel intense fear. And this is what happened. You start having intrusive thought, traumatic nightmares, and vivid flashback. So the memory of trauma will be there forever. And the problem with PTSD, this is very important. There is a guy, friend of mine, he's a cardiologist in Texas. And in 1981, he was tortured in prison. He was tortured later. Then he went into his life, he finished legal school, he went to Texas and became a very good surgeon. Very rich surgeon. Then in the middle of the night in 2015, after 35 years, his wife called me in the middle of the night. She said, Dr. Ali, your friend Abdul is dying. What's happened? He started having these nightmares about what happened to him in the prison after 30 years. So the amygdala, here is the trick. The amygdala will never forget the trauma. It will make you feel it happened yesterday, even though it happened 35 years ago. But it make you feel it happened yesterday, and it start to destroy your life and make you feel very anxious. So all of that is memory located in the hippocampus, but the trigger of that memory is the amygdala that activates. And could be the activation due to smell. It's like you smell something, like a lot of the veterans in America when it's rain, become tropical. And that tropical things make you remember what happened to you in Vietnam, because Vietnam is very rainy and tropical. So most of them, when it's raining, they will become remember all of these traumatic memories. It happened to me one time, my wife noted that because when I used to live in Tennessee at that time, it's rainy all the time. So whenever it's raining here in Riyadh, my wife noted that I start speaking English. So it just reminded me that I was in Tennessee again. So smell is the most important part. Why? Because smell, all the sense will go to the hypothalamus, then to the amygdala, except smell goes directly to the amygdala. So 70% of the trigger of any trauma is the smell. So let's go on here. And this is the diagnostic criteria. I want you to read it on your own. So first, if it's less than 1 month, will be acute stress. More than 1 month, it's PTSD. This is the criteria. Criteria one is exposure to actual threatened death, like something horrible, not more than usual. Then fear of re-experiencing that trauma, and third is avoidance, so you start avoiding the trauma. Most of them will avoid by, like if you are raped, you will hate man and you will not be social, or have a negative alteration in cognition, so you become forgetful and not aware of what's going on. What is the symptom? As we said, flashback, intense psychological reaction. We mentioned all of that. And one of the things that is really important in patients with trauma is startle response, shooting startle response. And if you come from back and touch him like this, he will not like this, he will jump severely. And those patients are very, very sensitive to that. So if you startle them, they will become so anxious. And they feel guilt and shame and anger, especially if it was rape. So there will be a lot of shame and anger. They feel dirty. They feel they hate man. They have a lot of inside anger. They cannot concentrate. They become hypervigilant. Hypervigilant, he is looking around. And this is another way looking at the picture of that trauma. First one is re-experiencing the trauma. So this lady could keep re-experiencing what happened to her during the rape and remember this traumatic memory. They have intrusive thoughts, so means that the memory of the trauma comes to your mind all the time, prevent you from sleeping, and you have all of these flashbacks. All of these symptoms will make you avoid certain situations, like you will never go to the mall or Starbucks, and you don't go to college, and you like to stay home most of the time, and not be touched and be around people, so we call that avoidance. A negative a change in mood, so you become depressed, you become isolated, you always, if you have a good news, then your brain will not process a good news because it always processes the bad news. And you can't not sleep at night, and you have all of these hypervigilant. Hypervigilant means you are always on the verge of coming back. And we mentioned the trauma is located in the amygdala and the hippocampus. The amygdala is the one that triggers this memory in the hippocampus, and we say the amygdala come from the Greek word means almond. So if you go to Athens in Greece and you tell him, give me a kilo of amygdala, he will give you almond. So re-experiencing is, we mentioned the example of 4th of July, where most patients, when they hear this loud explosion, they go and hide under the truck, unconscious. They will do that. For example, if you have a traumatic childhood, if your father used to scream at you, and then your husband or your wife scream at you, you become very, very anxious. Why? Because it will bring the memory of the childhood immediately to you. So people who are exposed to trauma, we mentioned trauma is like one-time deal. You be, la samah Allah, rape or car accident or war. But people who are exposed to chronic trauma, like if you are a child and you've been sexually or physically abused by somebody in the family, there's been trauma going on for a long time. We call that complex PTSD, CPTSD, which happened like for this little girl who been abused as a child. She grew up to be abused physically and sexually and mentally. So she had chronic developmental trauma. So she had a problem in the foundation of her personality. She was unable to be a normal person because during her childhood she was exposed to this trauma. And this results from serious developmental disturbance. That's mean in her formative year, when she is formed, she had this trauma. So it was involved in all of her personality and integrated in all of her brain development. The symptom of this lady will become, she will have very hard time in relationships. So if she get married, she will never be able to have good relation with her husband. She had very poor self-esteem because she feel dirty and feel angry. And she had what we call mood instability. That means some of them will develop borderline personality. Anybody knows about borderline? This is what we're going to talk about in the next lectures, inshallah. Borderline personality, most of them have childhood difficulties, and they don't have good maturity of the brain, and they develop mood instability. So whenever you see a lady who her moods change a lot, and you cannot predict her anger, that we call borderline personality. We'll talk about it in the next lecture, inshallah. So this is the symptom again: avoidance, intrusive thought. I'm just represent this to you. Intrusive thought, that means you have the flashback of what happened in your mind all the time, and you try to avoid certain situation where you remember this. You have negative thought, that means you are always think in a negative way. Why? Because the amygdala does not trust you anymore. Because the amygdala used to trust you in the beginning, but then when you have this rape or trauma, the amygdala become hypervigilant, and she interprets everything as negative. So if you have a good news, the amygdala will tell you it's not that good. If you have bad news, the amygdala will make you feel it's really very bad. And you become hyper-arousal. Hyper-arousal, that means you are always like this. If you hear a sound, you will jump. You will be all the time hypervigilant. And there's a lot of these patients, believe me. In the neurobiology of PTSD, we mentioned that the traumatic memory is located here in the amygdala and the hippocampus. This is where we keep our memory. And usually, if you have a good frontal lobe, it will control the amygdala. So let's see, I hear a loud noise here. If I'm traumatized, I will jump and be scared. But if I have good frontal lobe, the good frontal lobe will be able to adjust the fear in the amygdala and control that amygdala. So if the amygdala is hyperactive, the role of the frontal lobe is to tell the amygdala, okay, amygdala, just listen, it's not that bad, it's nothing serious. Or let's see, if you fail in the exam, and you used to fail in the exam, the amygdala will immediately make you feel panic because your life is destroyed, there is no way. The frontal lobe will come and tell you, maybe there is khira in that, and God wants you to have another plan for you. You did your job, you tried, and you failed, it's okay, just let's try again. So the positive part of the frontal lobe is the one who try to control the amygdala. In PTSD, the amygdala will take over and the frontal lobe will not be able to calm down the amygdala. So we call that hypoactive frontal lobe to control the amygdala, because the amygdala is the part that start that feeling. And of course, the hippocampus is the one that also helps with the amygdala and mediate between the amygdala and hippocampus and try to change this form of the memory. So always we need to have a good hippocampus that help us with that amygdala. So they say if you have a good hippocampus, you will not be stressed out. So for example, you really need to take care of your hippocampus. How we can take care of our hippocampus? Our hippocampus, we need to sleep at night. Sleeping at night is the best way to make our hippocampus grow. And sometimes we take antidepressant because hippocampus is also where it will decrease the hyperactivity of the amygdala. It will try to help with the hyperactivity of the amygdala. So they found out that most patients who's been exposed to trauma but never show any symptom of trauma, they have very good hippocampus here. Okay. And this is the neurobiology, as we say. The amygdala is hyperactive, as you can see here, hypervigilant, and then the hyperarousal become a part of your brain. The frontal lobe trying to dampen down that symptom. Hippocampus is also the process of the memory and try to help you here and try to erase those memories. And then the neurotransmitter, when you are stressed out, you have plenty of norepinephrine hyperactivity. That's why we use medication like SSRIs, because SSRIs will decrease the intensity of the norepinephrine and decrease the norepinephrine. Where is norepinephrine secreted from the locus coeruleus here? Under the influence of the amygdala. Norepinephrine is the neurotransmitter that makes us, so when you see somebody hypervigilant and anxious, that's mean they have norepinephrine very high. Their heart is pumping, they have panic attack. Say PTSD is having like panic attack. And this is, we mentioned that the hippocampus is difficulty. Their hippocampus cannot distinguish between real threat and just memory of the threat. Sometimes their hippocampus is unable to distinguish between reality and what happened to them at that time. Let's move here. And sometimes it will bring a volcano of a flashback. And here, there was a lady, let me sit here, who was in my clinic. She had severe PTSD. Her name is Buffy. She committed suicide, that's why I mentioned it. And she was traumatized a lot by her parents, by her mother, by everybody. Traumatized her. So Buffy is scared of people. She trusts only me. When she comes to the clinic, she just trusts me. So one time my professor came to sit with us in the session. When he came, Buffy had like a volcano of emotion. She felt so scared. Apparently that professor reminded her of her parents, of her father, and she started having severe panic attack. She ran away from the clinic, started screaming in the parking lot, and I was running after her when I killed herself. This is what happened to me. Sometimes if you touch on some important point or they smell something, the hippocampus will open all the old memory here, and the patient will have a flashback, means volcano of emotion which come to her life and make her severely anxious and depressed. Okay. The good news here is most of us, this is very important exam question. And normally, when we have a trauma, we have increase in CRH, you know CRH, then pituitary gland, then ACTH, then cortisol. This is the cascade we call HP axis. In PTSD, for some reason, CRH will not activate cortisol, so they still have low cortisol. Even though they should have high cortisol, in PTSD, the cortisol will not get high. We call that paradoxical blunting. So for some reason, the cortisol will not go up to just the norepinephrine. So what will that mean for them is like the cortisol failed to increase in the adrenal gland, and that's to protect you, because if your cortisol goes up, then it will bring all the bad memories, so and become very, very hypervigilant. So in those patients with PTSD, the cortisol will not go up. So this is the typical feature of PTSD. Then let's go in this and see what does that mean. Because cortisol and norepinephrine are really important, and this is what happens. So let's see, you see this line here. Your catecholamine norepinephrine will go up, but your cortisol level is still down because of that mechanism. So the amygdala try to remember that, and it has very strong memory of that trauma instead of regular memory, because when norepinephrine is high, then you develop very high memory of the trauma. For example, you all remember the time where you had very, very good memory. For example, when is your graduation day? You remember all the detail of that day because it has a strong memory, because it has a lot of norepinephrine. Norepinephrine, the role of norepinephrine is to make the memory strong. Okay? So our emotional memory always is strong. The reason why I give you a lot of story during my lectures is the story will increase your norepinephrine because you become alert. That norepinephrine will make you never forget that story. Okay? Why? Because it's consulted with a very strong memory, because you have very high norepinephrine. And the reason the brain does that is because it doesn't want you to have this again, never forget it. So the reason why he had strong memory of that lion, because the body does not want you to be eaten by that lion again. In order for you to develop a strong memory of that lion, you need very high norepinephrine to have a strong memory, so you will not be get hurt again. Did you get it? Should I repeat? Let's repeat it. So high catecholamine means high emotion, strengthened memory. So whenever something bad event happen, you have very high increase in catecholamine or norepinephrine. The role catecholamine is norepinephrine, you know that. So to strengthen the memory so you will not get hurt again, you develop this high memory of that event so you will not be eaten by the lion again. And in order for you to do that, you need low cortisol and high catecholamine. So low cortisol and high catecholamine is a defense mechanism the brain do for you to not to be hurt again, so you develop a strong memory of that. Was I able to convey this? So why do we have low cortisol and high norepinephrine? Because norepinephrine will make the memory strong. When you have a strong memory, then you will not get hurt again. Wow. Like I remember one time I bought a Toyota Camry, and I have a nightmare from Toyota Camry. Why? Because the steering wheel was very loose, and I was about to have a car accident one time. So since then, when I see a Toyota Camry, I feel scared. Why? Because during that incident where I almost had a car accident, my memory of that was very strong, so all the Toyota Camry becomes very strong memory, so I try to avoid Toyota Camry. So what happened is in the PTSD, when we are stressed out, there is a whole disturbance in our place. The amygdala will make locus ceruleus secrete a lot of norepinephrine, and we have this decreased serotonin, increased dopamine, decreased GABA. So all of this is neurotransmitter regulation, and you don't have to know them. What is the treatment for PTSD? The treatment, we give SSRIs, because SSRIs will dampen the amygdala. Okay, so SSRIs is the best treatment. It will decrease the activity in the amygdala. It will make you forget things. Sometimes we give these antidepressant, antipsychotic. The best treatment is really cognitive processing. Sometimes they use this EMDR. Now, a lot of people swear by it, EMDR. What is EMDR? You can read about it. I personally don't believe in it. But there's a lot of people who make a living out of that. So the way is they say if we move, like they come to you and look at my finger. What is your name? Roa. Roa, look at my finger. Just keep looking. Keep looking. So we spend like 20 minutes trying to move your eyes. They said if you move your eyes like this, it will erase all the memory, the traumatic memory in the brain. I personally, and I charge 300 riyal for it, so I don't think it's very effective, but there's a lot of virtual reality now and a lot of training about it. And we do compartmentalization. That's mean some people are good about forgetting the trauma, so they put it in one part of the brain and lock it here, and then leave everything else open so you can go on with your life. So we call that compartmentalization. We'll go now to OCD. Finish with PTSD. Hopefully we'll have time. This is a story of a lady. What is her name? Name her. Somebody name her. Should say her. Selma. Good. Selma. Selma is interesting lady. She wake up. She had an appointment with me at 9 o'clock. Okay. She wake up at 7. Okay. She literally, she told me, she washed her hand like for an hour. Then this is 2, she locked the door like 60 times, make sure it's locked, 20 times check. Then she go and drive her car to come to see me. She will sit in the car, she will check the car like 100 times. And then she drive like 2 miles and then stop and look at the road to see if she hit any big cat or anybody. Then she drive another 20 miles and to make sure. So by the time she reach our clinic, it will be 4 o'clock. So it take her 8 hours just to reach my clinic. The driving is 20 minutes, but it take her at least 8 hours between checking and cleaning, and this is her life. So what happened is she had OCD, obsessive compulsive disorder. Obsessive compulsive disorder is a feeling that obsession, like come to your mind now, I'm Dr. I have OCD, feel, oh, my hand is dirty, okay, I'm going to wash my hand. Then I go back, it's still dirty, I go wash it. So I wash my hand like 60 times, to the point where a lot of patients will have like skin bleeding from the cleaning. And then it's ego dystonic. Showing ego dystonic means I don't like to do it. I'm forced to do it. I cannot not do it. If I don't do it, I will become anxious. So obsession, no, I have realistic and irrational feeling about my dirty hand. Compulsion to decrease anxiety, I go and wash my hand many times. So the role of compulsion is to what? Reduce the anxiety. And this is the statistics. So most of the OCD is checking, washing, counting, and symmetry. They are obsessed with symmetry. So everything, like if this, let's see here, if this is a little bit off, it will drive him crazy to make it very symmetrical. So they are very obsessed with symmetry and germs. And they have obsession or intrusive thought. So did I lock the door? Fear of contamination. Harmful thoughts. So they have a lot of thoughts. I'm sit here, and then this is the exact procedure. Okay, I'm sitting here, I have OCD. So my intrusive thought is there gonna be a dust storm in the Riyadh, then this will ruin my breathing, then I will have asthma, then I will go to the ER, and then I have no insurance, they will not give me medication, then I will be suffocated, I will have hard time breathing, then I'll call my mom and tell her I'm not breathing, then she has to have. They make all of this scenario intrusive thought about exaggerating things. And a lot of them are really spending time and time in this intrusive thought about their life, and they cannot keep this out of their symptom. So a lot of the symptom of OCD is not really washing or cleaning. It's just this intrusive thought. The patient will tell you, this thought is really forced themselves into my brain. I cannot get rid of it. Like you will go and say, if I fail USMLE or SMLE, I will not find a job, I will not find zaytun or makdous to eat, then I will not be able to buy Starbucks, then I will have no caffeine, and all of these scenarios coming to intrusively to your brain, and the problem, you cannot stop this from coming to your brain. So this is, intrusive thought is very common feature of OCD. And compulsion, we said cleaning and washing and on being symmetry. So this is one part, and this is the other part. And this is the intrusive thought. This is really ruin their life. So they spend all of their mental energy just talking about this intrusive thought. Okay. So the thought is the common repeated thought that comes to your mind. Compulsion is a behavior you do, like washing your hand or checking the door. So this is obsession about cleaning. She feels her hand had a lot of germs. She will have anxiety about it. She will go and clean. This will happen again and again and again, like 20 times a day. So obsessive compulsive is very common. Some people here exactly, they have a lot of obsession with wudu and prayer. So I have one lady who would like do wudu like 20 times. Her father told me that she spent 2 hours just praying Fajr or Dhuhr. She keep repeating she is not sure whether she did the Ruk'ah right or did the Quran right, or so she keep being obsessed with Salat. So there is a lot of religious behavior about this patient, especially in wudu or in some people will have obsession with saying bad things that might make God angry at them. So this is what happened with those patients. So here we go to summarize it. What if the intrusive thought really ruined their life because of what if it's rain today, what will happen to my son, what will happen to me, what happened to my scholarship. I cannot stop thinking. So this thought comes intruding, and some people will try to deal with that by using substance or taking medication or avoid these thoughts at any case. So obsession, compulsion, recognition. So this is these 5 criteria. I want you to read it on your own. Some OCD might have what we call tic disorder. So it's common to have 40% of them or less have what we call tic disorder with it. So it's tell us that it's a problem in the basal ganglia. And this is to summarize all of that, so you can read it on your own. This is not going to happen in the exam. So this is a lot of the thought are really this one. So a lot of these thought is sexual fantasy and sexual behavior. And some patients will really ruin their life with this, so they just imagine things happen sexually with them and being very, very obsessed with it. And this is very, very common in OCD. So they have a frequent, severe obsession with sexual activity, and they spend time on the net to increase this sexual, aggressive, intrusive thought. And some of them, we say, the religious intrusive thought about did I do wudu right or not, did I clean everything, and then they have a lot of distressing image about themselves and their loved one. Common compulsion, as we said, washing and checking, counting. So if you see a patient here, he will count how many square here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. He will count all of this. How many hole here, like he will hand 1, 2, 3. Just keep counting and counting and spending their time. How many lamp we have here? So they keep spending all their time counting and ordering. And some of them will have rituals. So ritual is like I have to touch the door 17 times before I enter. Or I have to be obsessed with number 6, so I will put my hand 6 times on the door before I enter the door. So you see a lot of features from OCD, and usually it's ego dystonic, uni-ego dystonic. So we have to differentiate between OCD and OCPD. Ego dystonic means I don't like to do it. It's really giving me hard time. I want to get rid of it, but I cannot do it. But there's some people who have obsessive personality disorder. It's part of their job to look at everything to be perfect. Like if I want to write an essay, I have to make it perfect without any mistake. This is ego syntonic. I want to do it because it's part of me. Ego dystonic is not, it's alien to me. I don't like to do it, cause me a lot of anxiety. And we said symmetry is one of the, so they will drive them crazy to see the pencil like this. They have to be obsessed with 3 here, 4 here. So obsession is very common. Prevalence is 3.3 million American have it. So it's about 3% of the population. Male have higher checking, female have higher washing. Equal in male and female. Usually happen in the mid-adolescent, and usually it's usually more in the after stressful event. Usually dysregulation in the key brain area. The key brain area is orbitofrontal cortex, anterior cingulate cortex, striatum, and thalamus. So we'll show you this is what we call the. So if you want to explain that to me, let me explain it to you here. So at start, we call that STCSU, because this comes in the exam, so I want you to know it. Let's see, I want to go here to help you with that. Okay, listen to me, girls. So what happened is STC, so C is for the cortex. I decide my hand is dirty, I need to wash my hand because my hand is dirty. Then it sent a message to the basal ganglia. Basal ganglia means, a striatum. This is striatum, is basal ganglia. So C is the cortex, S is the striatum. The striatum is responsible for the movement, so it will develop the movement. Then it will clean my hand. It will send a message to the thalamus, because thalamus is the secretary of the brain. Tell him we wash our hands. The thalamus send a feedback to the cortex that we wash their hands. So S, C, S, T, C again. C, S, T, C again. Got it? What happened this is what we call the anxiety loop. What will happen is apparently something in the striatum will tell you that it's not done well, or the thalamus is not done well, repeat it again. So you keep repeating. Where is the damage? They said the damage most of the time happen in the striatum, basal ganglia. Lesion. Basal ganglia sometimes, OCD happens sometimes if you have a strep infection. What happens with strep infection, there's a certain kind called pandas. Pandas is an OCD that happened after damage to the basal ganglia. So if you have strep infection, the immune complex will participate or will be done on the basal ganglia and destroy the function of the basal ganglia as then you repeat it again. So if you have a child who had OCD, it will be after strep infection. Okay? Because it will do. So damage we said here is in the basal ganglia. Striatum is the capital of basal ganglia. واضح يا صباح؟ Because this comes in the exam sometime. Apparently I have to go back here. فهمنا الاس C, S, T, C, and that's why it's sometimes accompanied by what we call some movement disorder, because basal ganglia is responsible for our movement disorder. And let's see here. This is explain all of that. So I want you to read it on your own. This is PADIS. So PADIS is autoimmune disease. So the infection, strep infection, will have particle located on the basal ganglia, destroy the work of the basal ganglia. So if you have a child who has OCD, make sure you don't miss the strep infection. Okay? واضح طبعا. Psychological influence. They said here it's in the pathology of OCD is related to the gene, so apparently you have a gene. So not all of us will develop OCD unless we have the genetic makeup of that. Then we have a stressful event, trauma that trigger that gene like any other illness, and then it could be we have OCD. So this is an autoimmune disease that where the immunological complex start to locate on the basal ganglia and destroy the function of the basal ganglia. Treatment, course of OCD, usually it happens in the adolescent, early adulthood, then most of them will get better with the treatment, and treatment is very, very essential. 5% will have very, very aggressive course all the time. Treatment is really psychotherapy and medication. Prognosis is depend if you get good treatment or not. SSRIs is still the what we call, let me see SSRIs here for a second. We'll go to treatment in a few minutes. Okay, so the trigger will be stress or any event. Obsession will become obsessed with it, we feel anxious, we comply, we have compulsion, we clean, and we relieve when we clean, we relieve our anxiety, then we'll do it again. So this is the loop of the STC. We'll go to another part called body dysmorphic. Dysmorphic means ugly face. So this lady is very beautiful, but she feels like there is something wrong in her face. So she go to the plastic surgeon and spend all of her time going to plastic surgery. Usually very common in female, more likely in female. Condition believe they are physically deformed, so she feels her face is deformed. She need more Botox here, less Botox there, and she keep going to skin surgery all the time. They said it has high level of suicide. Plastic surgery, antipsychotic do not work, so they usually go to plastic surgery all the time, and they find themselves in plastic surgery. There is another illness similar, because this illness is similar to OCD, so they call it OCD spectrum. That's mean OCD and trichotillomania and body dysmorphic. 1 second. Trichotillomania is when they keep. Yes.
Is body dysmorphia related to eating disorders?
Yes, it's very common with eating disorder, yes. But it's part of the OCD spectrum. OCD spectrum is Tourette syndrome, body dysmorphic, and trichotillomania, because they have the same system.
Okay.
Yes?
Does that mean that people who have OCD are more likely to develop an eating disorder?
Eating disorder and PTSD and PTSD, eating disorder, OCD, borderline personality are 4 or 5 illnesses that usually comes to the illness. Especially eating disorder and borderline personality and OCD and PTSD. All of them. You know, some people will OCD happen after they have a traumatic event. So OCD treatment is behavioral therapy and medication. This is the medication we use for. Sometimes we use SSRIs, clomipramine, tricyclic, and risperidone. So we use all of these 3 medications. And this is for USMLE, so I wanted to read it because this will summarize everything. If you have any question, let me know.